Hi, my name is Dr. Salima Meherali, and I am an associate professor at the Faculty of Nursing, University of Alberta. I recently published an article, Adolescents' Voices in Action, Co-Designing Digital Sexual and Reproductive Health Knowledge Translation Interventions, a community-based participatory action research project in JMIR Human Factors. In our paper, we demonstrate how adolescents can meaningfully contribute to the co-design of a digital, sexual and reproductive health interventions. Adolescents frequently encounter misinformation, stigma, and inconsistent guidance when seeking sexual and reproductive health knowledge. Traditional top down approaches often fail to reflect the lived experiences, cultural context, and communication preferences of young people. Recognizing this gap, the research team adopted a community based participatory research framework grounded in human centered design principles to ensure that adolescents were not merely participants but active collaborators. We conducted a multi site study in Canada to co design an evidence based digital platform for youth to access sexual and reproductive health information. Co-design is a participatory action research approach that brings together community members, stakeholders, and researchers to collaboratively develop, design, and implement interventions to address issues within the community. This project was informed by our past work with this population, where we found that despite the availability of online information, adolescents continue to face barriers to accessing accurate, inclusive, and developmentally appropriate sexual and reproductive health resources. The first stage of our study was the establishment of Adolescent Advisory Group. 26 adolescents from three major cities in Canada, which is Edmonton, Toronto, and Vancouver, were recruited to be part of these groups, who were meaningfully engaged throughout the project and participate as active members during each activity. These groups met regularly over several months to participate in design thinking sessions and guided the entire course of project, from drafting interviewing questions to finalize the design of the intervention. Through iterative workshops, brainstorming sessions, prototype testing, and structured feedback activities, participants contributed to every stage of the design process. The groups weighed on findings from different stages of the study and finalized six priority areas that they would like to see evidence based sexual and reproductive health resources should be developed. Their insights extended beyond content to include tone, visual design, navigation, and the overall user experiences. Participants emphasized the importance of accessible language, culturally relevant examples, and non judgmental, trustworthy environment. The co-design process revealed that adolescents value digital resources that are interactive, visually appealing, and reflective of their diverse identities and experiences. Importantly, our study demonstrated that youth are capable of providing sophisticated, actionable design recommendations when given the opportunity and appropriate support. The resulting intervention is not simply a repository of information, it is a youth-informed digital tool shaped by the perspectives of those it aims to serve. Our study highlights the value of participatory approaches in digital health development and signifies the importance of treating adolescents as experts in their own needs. The findings offer a model for future initiatives seeking to enhance relevance, usability, and long-term adoption of digital health resources. The study affirms that when young people are empowered as partners, the resulting interventions are more meaningful, more effective, and more likely to support informed decision making. We chose to submit our research to JMIR publications because the JMIR Human Factors is a leading venue for digital health scholarship and offers strong alignment with our studies focused on co-design, youth engagement, and human-centered digital interventions. Because our research aims to inform the development of equitable and youth-centered digital health tools, it was important to publish in a journal that ensures broad accessibility to practitioners, policymakers, and researchers, and has a mission to advance evidence based technology enabled health solutions.